Krista? Hi, Krista.
Hi, how are you?
I'm well. Can you see me?
I can.
Can you hear me?
I can.
Okay.
Perfect. All right, so we are all set then. I'm going to change your name because you're not Krista Berry. I don't know if you can see that. Do you go by Pam or Pamela?
Pam is fine.
Pam, okay. Now, are you in your office or are you at home?
I'm at home.
Mm-hmm.
My last day in the office was Friday the 13th in March. So
Yeah.
it's been a while.
I think we finished up the Friday before, perhaps, the 6th.
Mhm.
So, right, what am I thinking? Here we go. Okay. So I think at this point, you and I have access, but no one else will have access.
Okay.
So I got really lucky when we did this with Dr. Carey that all the technology went really well. So we'll just have to, I should have controls to be able to mute everybody and watch the chat. So again, kind of, go ahead.
So I was going to ask if there should be technical problems.
All right, good afternoon, everyone. We've got a good group starting. I imagine a few more folks will be joining us. So I still, even though we've been home for a matter of months, it never still quite feels real that we're doing so much communication in this virtual way. So I'm just so thankful for all of you to have joined us and really hope we can all learn a lot and gain a lot from our time together over the next hour. So I just want to introduce myself. My name is Krista Parkberry. I'm the Executive Director with Komen, North Carolina Triangle to the Coast, where we are all about saving lives, meeting the most critical needs in our community, and funding breakthrough research to really prevent and cure breast cancer. That's our mission. It guides the work that we do. And during this time of COVID, we've been trying to listen real closely to what breast cancer patients and their families and those impacted by the disease in some way, those living with metastatic breast cancer, just what the questions are out there, what are the concerns, what questions folks have as we're continuing on in this virtual setting, this shelter at home setting, in addition to regular stress for patients oftentimes and those living with MBC. There's different health concerns and fears and anxiety, and it's just so important. I think we've time and time, if you get on social, you go anywhere, there's lots of talk about self-care, how to take care of ourselves, whether that's going for a walk or taking a break from the computer. Sometimes I think it's easier said than done. But I think in particular, you know, carving out some space today to get questions answered and hearing from our guest presenter today, we hope helps support next steps for you to get the information you need and remember how important it is to be taking care of yourself at this time. So with your questions in mind, today is just going to be a very casual kind of virtual conversation with Pamela Durham, who is a counselor with the Comprehensive Cancer Center at part of UNC Health. You know, again, as I said, we believe it's really, really important for breast cancer and survivors and those living with MBC to really be informed as possible during this time and the days moving ahead. So we will explore what you need to know as far as COVID-19 and mental health and answer your questions as best possible. So I will be doing some guided Q&A questions with our speaker, and then we'll open up the latter part of the conversation for your questions live. There were a few submitted, but we will open it up. So as you have questions throughout our presentation, please feel free to add any questions or comments to the group chat box. So now I'd like to introduce our presenter, Pamela Durham. So Pam has spent 22 years working in a corporate environment before pursuing her passion of providing support to those challenged by cancer and its treatment. So after leaving what she calls her first career, she went back to earn her MS in rehabilitation psychology and counseling from UNC Chapel Hill. Go Tar Heels! Since 2004, she's had the privilege of providing psychosocial support to patients, caregivers, and couples as a counselor with the Comprehensive Cancer Support Program, which is part of the NC Cancer Center or Cancer Hospital, excuse me, in the home of UNC Lineberger Cancer Center. So with those, you know, with that background in mind, she does have special interests in helping those with a history of childhood trauma and help them tolerate and complete treatment, and helping patients navigate work-related challenges from diagnosis to survivorship. And she believes, and I quote, "It is always an honor to be invited to walk alongside another through their journey with cancer." Welcome, Pam. Thank you for joining us today.
Thank you, Krista. It's a privilege to be here, and I'm always happy to speak with breast cancer survivors and patients. That's the group that really piqued my interest and desire in working with cancer patients. So.
Well, great. Well, we're so pleased to have you here with us today. So I will start off with some questions. So my first question is, what are the mental health needs of breast cancer patients during normal times when there is no global health crisis?
Wow, you know, it feels like it's been so long since we've had normal times. I'd like to just sit with that thought for a moment, but these are not normal times. But even in normal times, you know, the participants are well aware that a diagnosis of breast cancer is very distressing, but the level of stress and therefore the need and desire for mental health services varies from person to person, and even with the same individual at different times along their treatment and in survivorship. So, you know, most people adjust and cope well after having some time after receiving the diagnosis, and they choose not to utilize mental health services, at least in an ongoing or formal way. But, you know, we're well aware that cancer patients are always at risk for adjustment disorder, for increased anxiety and depression, all of which can negatively impact functioning in life, certainly decrease the quality of life. And for some people, it's severe enough that it interferes with treatment adherence and therefore has the potential to make a difference in outcomes. So ideally, even under normal times, breast cancer patients should be screened routinely and regularly for distress, and then be made aware of the mental health services that are available to them, and encouraged to use those resources, whether they are in the cancer center where the patient is getting their treatment, whether those resources or services are in the larger community, and clearly in this time, what's available via telehealth. So for many patients, if they're going to receive mental health services, they would prefer to do that with someone who understands the physical and psychosocial challenges that breast cancer and treatment presents. Although it's not necessary, a lot of patients prefer it. And mental health providers who are familiar with those challenges can appreciate that a lot of the feelings and fears that patients feel, as uncomfortable as they are pretty normal and actually to be expected. They can help identify and develop coping strategies and stress reduction techniques for that individual patient. And if they have an ongoing relationship with the patient, can help monitor how that particular patient is adjusting to and coping with all of those challenges. And if they see indications that the patient would benefit from more intense mental health services, then they can help usher that patient toward the appropriate resources. I'd like to point out one other way that mental health providers can be helpful to breast cancer patients. I think it's a very important way, is mental health services are not only helpful when patients are struggling, when survivors are struggling, but they can also be helpful if an individual is interested in exploring how to integrate that experience into their life, how they make meaning from that, how they use that experience going forward in their life. And for some people, they want to use that experience almost as a springboard, if you will, into making changes in their life. So mental health services can be helpful to patients during and after treatment, both when they're struggling, but also when they want to use that experience to move forward.
Great, amazing, thank you. So, you know, right, we were talking right before this video started, since early March, right? We've been living a different life than we've known amidst the COVID-19 pandemic. So what are breast cancer patients dealing with now with the additional stress of COVID-19?
Yeah, so, you know, I think there are a lot of ways that COVID-19 is impacting, of course, everyone, but I think particularly for patients and perhaps even more so for those that are in the midst of treatment at this time. But there are several that stand out to me. I think the first is the COVID-19 threat. It just adds another thick, sticky layer of uncertainty about the future, on top of what many cancer patients are already feeling. So, you know, we know with uncertainty frequently comes more anxiety that can potentially affect us physically as well as emotionally. So you may very well be feeling an increased level of anxiety in your body and in your thoughts. Intrusive thoughts may be coming in even more so now than before. I'm also hearing from patients who are in active treatment and having to go to their cancer center frequently. I mean, infusions and radiation therapy require visits to the cancer center, and sometimes daily. And there's the fear that then exposes people to an increased risk to the virus. So I think we're keenly aware now that there's not a no risk option It's not risk versus no risk. It's risk versus an even higher risk. And so it can require a conversation with your healthcare providers to help tease out what is the greater risk so that you can then make informed choices and decisions about your health and also how to protect yourself as you need to return to your cancer center for treatment. The other thing that is clearly striking is that, unfortunately, having cancer or surviving cancer does not immunize people against other life problems. So breast cancer patients and their families are experiencing all of the same losses, insecurities, disruptions, inconveniences in their life that the rest of the country is experiencing as well. And that for many may include job loss or an income loss. And with job loss may come loss of insurance, which can be a very scary thing for people who are in the midst of treatment or who need surveillance going forward. There can be threats to housing and food security. I mean, we're seeing the long lines of people at food banks. So that's a real concern that breast cancer patients as well as others are facing. Many may have children at home with school closures, daycare closures, college students who are now had to move home. So sort of dealing with disruptions in your schedule and having additional expectations and duties placed on you. So I would encourage patients and survivors that if you're experiencing these challenges, let your healthcare team know that. There may very well be people available to you, social workers and so forth, who can help identify resources and then help you navigate those resources. So those are some of the ways that I think breast cancer patients are particularly affected by COVID-19.
Trying to get myself off mute. Thank you. Well, this next question we've been asked, and I think it dovetails a little bit what you were talking about just in terms of patients having to go in for treatments. But I'm curious to where you see mental health fit into that. So as far as, you know, breast cancer patients that are considering skipping their psychotherapy treatments to avoid exposure, what are your thoughts on that?
So first of all, my short answer would be no, don't skip those appointments. For two reasons, really. One, there are times that it's appropriate to reschedule appointments. We all have to do that from time to time. And there comes a time in psychotherapy when it feels appropriate to end therapy or at least take a break from it, knowing that you can come back to it at a later time. But I would be hard pressed to think of a time when just skipping a mental health appointment would ever be a good thing. In fact, times that we're most tempted to skip those appointments may actually be the time that we could have benefit from those appointments even more. So I would encourage not to just skip an appointment. And more specific to our discussion today is, I would be surprised if any mental health provider now was not making available appointments via video conferencing or telephone. So that's not going to put people at greater risk for keeping those appointments. In fact, if I stop and think about it, if there's a bright spot at all around COVID-19 from a mental health perspective, it's that it's brought about a change. It's almost forced a change, if you will, in regulations and policies and accepted practices that I think in the long run may make mental health more accessible to people, particularly people who live in areas where access to mental health providers may have been limited in the past. So if you are thinking about skipping an appointment, contact your mental health provider, give them the opportunity to offer you sessions via telehealth.
That's really great. And I love that silver lining. I like how there are things that I think are hopeful that will make great positive change, and kind of what haven't been forced to learn, but how we've helped problem solve.
It's unfortunate. Yeah, it's unfortunate it took a pandemic to get us to this point, but now that the genie is out of the bottle, I'm hoping that we can continue to use telehealth for mental health in ways that we just haven't in the past.
That's really great. Well, maybe speak a little bit about what advice you have for breast cancer patients who may be feeling more anxious or worried, just due to all the things that you've mentioned, and what we're all experiencing as part of this current health crisis.
Yeah, sure. So first of all, I would say that if you are feeling increased anxiety, don't be surprised by that at all. It's not surprising. Everyone is experiencing an increase in feelings of anxiety. That's not to say, though, that we shouldn't take steps to reduce that in healthy ways. We can reduce our exposure to things that heighten our anxiety. For example, limiting our exposure to things that we know trigger anxiety. But also be aware we're not going to eliminate stress and anxiety from our lives. We couldn't do that in normal times, and we're certainly not going to do that now. And even though we can reduce stress and anxiety temporarily, those feelings are going to come back. It's the wave of stress and anxiety that comes in, and then it, flows out, but another wave is going to come at some point. So having said that, though, we're not powerless against these unpleasant feelings, whether they're mildly unpleasant, even to the extent that they can feel crippling, almost crippling at times. There are tools that are available that we can use. For example, limiting exposure to the news or social media, or even people who don't seem to be able to talk about anything else other than COVID-19. It's appropriate to set boundaries around those things. So, if it's necessary to allow yourself so much time to watch the news or to be on social media, then it's appropriate to set a timer, or what shows that you'll watch the evening news, but you're not going to sit in front of it as they continue to talk about COVID-19. I think it's a little easier to do that now than it was in the first weeks, when we were pretty much all glued to the television trying to get as much information as we can. I think it's certainly appropriate to listen to the news as much as you need to be informed, so you can make informed choices for your health and your well-being. It's another to sort of be consumed by that to the extent that it just feels overwhelming. So I would encourage you to check in with yourself throughout the day. If you need to set an alarm on your phone or computer to remind yourself to do that, and just step back and notice, what are you doing at that time? What's rolling through your head? What thoughts are you having? What feelings might be churning around? Have you kind of drifted into something that is unhelpful? If so, just, note that, acknowledge it, and then kind of gently bring yourself back to your task. Don't beat yourself up about it. Don't chastise yourself or just give up and feel that you are at the mercy of those intrusive thoughts. But be gentle with yourself as you bring yourself back to task. Another thing that I would encourage is to shift your focus away from those things that cause you to feel anxious, and to the things that are important in your life. People, relationships, activities, goals, those things that are meaningful to you, that are important to you. focus on living your life in a way that's consistent with your values, in spite of still feeling anxious. It might be hard to imagine doing this, but if you can think about reading a book while you've got the radio playing in the background, you're aware that the radio's playing, but you are not tuned into it so much that you even notice what song is playing. You're just aware that it's there because you're focused on reading your book. So if we can almost move anxiety into the position of the radio, right? We're aware it's there. We have those feelings in our body, but we're focused on what's important to us. So that's where our energy, that's where our focus is. And we're not utilizing all that energy and effort to try to not feel anxious. That takes some practice. It's easier said than done. I get that. But with some practice, it's a matter of choosing to focus on what's important to you, even in spite of anxiety, rather than trying to make the anxiety go totally away. I would also encourage you to schedule time, and it may mean putting it on your calendar. Do something fun. Schedule relaxation in your day. Do things that bring you joy. Both cancer and COVID have a way of kind of pushing their way into your life and overshadowing everything else. And it can really take some effort to kind of move that aside and remember that that's not your whole life. If you are looking for examples of things that don't take a lot of time but can help reduce stress and be fun, there's a website called Be Strong Families. They have a link to a poster that lists 100 ways to reduce toxic stress. Now, I've looked at that, and there's probably at least 95 out of the 100 things that you can do in one way or another while still practicing physical distancing from others. Krista, I know you mentioned early on self-care, and we're hearing that from a lot of places now. And we have a tendency to tune out those things that we hear repeatedly. But I would encourage you not to do that with this message of self-care. It's so important right now. Think about your sleep, get adequate sleep. Think about your diet as nourishment. Not only taking in good food, but also reducing perhaps caffeine and alcohol, because those things can make us feel even more anxious. Get up and move, whether it's going for a walk, whether it's a run, whether it's turning on the radio and dancing. Get outside in nature, hear the birds, feel the sun on your face. And if you have a mindfulness practice, now's not the time to abandon that. Continue with that. There are a lot of apps that you can put on your phone. There's Calm, there's Headspace, 10% Happier. One that I like is Mindfulness Coach. It's developed by the U.S. Department of Veterans Affairs. I think it's a good site that if you're not familiar with mindfulness, it does some education and kind of helps slowly move you into a mindfulness practice. So do be diligent with the self-care.
Well, great, thank you. I did add the Be Strong Families link to our chat space. So again, if people have questions, feel free to add your questions there. It looks like someone has. So we have a few more we'll go through, but I will continue to add some of those resources and links to apps that Pam has mentioned as we go on, and as well as we will be placing stuff on our website after this call. So my next question is, we do a lot of work with loved one support folks, caretakers, kind of co-survivors, what are some things that family members and friends and caregivers can do at this time to ease breast cancer patients and those living with MBC, their anxiety and depression during COVID?
Right. So, you know, our family and friends, caregivers are so important to us when we're going through treatment for breast cancer and into survivorship. So there are things that family and friends, caregivers can do to be helpful during this time. And also breast cancer patients and survivors who are now caring for others. My first advice would be take care of yourself, physically and emotionally, because you can't give what you don't have. And if you are a caregiver, not taking care of yourself is a luxury that you just really can't afford right now. So it's so important that caregivers take care of themselves. If you feel exhausted as a caregiver, you don't have energy to give to the person that you want to care for. And if you're stressed, it's going to be really hard to help someone else kind of calm down. And if you're agitated, it's hard to help someone else relax. Those things can overshadow any attempt that you make at being helpful to the person that you love. So taking care of yourself is so important. It also provides a living example of what taking responsibility for your own self-care looks like. I mean, we've all heard that a picture's worth 1,000 words. Well, a living example is even more powerful. It demonstrates that you actually believe taking care of yourself is important and is helpful. And it gives you credibility then that when you're trying to encourage someone else to care for themselves, you're more believable. And now I think is an important time. I mean, we've got an opportunity for patients and survivors who have their children at home and are now having to be involved in a hands-on way in their education. This is a time that you can teach them that self-care is important and can help build their resilience and help them cope then with the challenges that they're facing now. But also it's a great gift to give them, for them to carry into their future as adults, to learn to take care of themselves. Secondly, I would encourage caregivers, family, to allow your loved one to have their feelings and to express them. Even when it's hard to hear that, it's important for patients, survivors, for all of us actually, to feel that we are heard and to have what we're experiencing validated. So listen, be present. Don't sell short just your physical presence. That can be great support. Don't try to minimize this experience. Acknowledge that it's a scary time for a lot of people. Acknowledge their thoughts, their feelings, and if it's appropriate, normalize them. You know, if you've got a loved one that's getting ready to go tomorrow for an infusion and they're expressing concern about that, you know, to say, I hear you're anxious about going to the cancer center tomorrow. I get that, that's understandable. What can we do that would help you feel more calm? I mean, is there a plan that we can put together to help minimize your risk and therefore kind of bring down some of that anxiety? Or if somebody has finished treatment, right, and there was a celebration of some sort planned, to say, you know, I hear you, I know you're sad, disappointed, angry, whatever it is, that we can't celebrate your finishing treatment the way that we had planned to. I'm disappointed about that too, but what can we do now, that we can do now, to kind of mark that important time? Another type of support that I think is important is what we refer to as esteem support. And by that, I mean, you communicate to your loved one that you have confidence in their ability to get through this. Yes, it's hard. Yes, it's scary. You would prefer not to have to do it, but you can, right? And then companion support. We'll get through this together. We may not know right now how we're going to do that, but somehow you and I together will figure this out. We can do this and we'll get through it. And lastly, as a mental health professional, I think I would be remiss not to say that if you are concerned about a loved one, particularly if they're depressed, familiarize yourself with the symptoms of depression. It's easy enough. You can Google symptoms of depression and you'll find a long list of links to provide you that information. And then if you notice that your loved one is showing symptoms of depression, bring that to their attention. Let them know what you're seeing. Be specific about what you're observing. And let them know that you're bringing this to their attention because you're concerned about them, you love them, you care about them. Be non-judgmental, and then encourage them to get support. And if they need help finding resources for support simply because they may not have the energy to do that themselves, then offer to help them do that. And should they say anything that causes you to be really concerned about their safety, take any threat seriously and then take the appropriate action for that.
Great, thank you. I appreciate that first bit about modeling and practicing and just how important that is to do. Myself as having little ones in the house, but just again, how, you know, we can all become more comfortable when we see it around us and give us permission to take care of ourselves. I think at this point, based on time, we have had one question come in. I may see if there's other questions to answer. And then we can talk a little bit more about what's specific at Lineberger, but I'd love to give a chance for our audience to get their questions answered. So one question that has come in is, can you share suggestions about how to decide what is safe and what is not when living with metastatic breast cancer?
So I would encourage patients with metastatic breast cancer to take the precautions that the health officials has been telling us all along. Wear a face covering, hand washing. If you choose to wear gloves, that's fine, but it's not a substitute for washing your hands. Keeping that physical distance. If you have to be around other people, do keep that distance. If you have to be on an elevator with someone, kind of turn your back towards that person. But beyond that, I think it's important that people living with MBC, as well as other patients who are in active treatment, have a conversation with your healthcare provider to fully understand what the risks are for you. And that can vary from person to person. And I think the individual that's in the best position to answer that for you is your primary oncologist.
Mm-hmm. Okay, that leads me to think a little bit about, you know, what about mental health needs of patients with chronic conditions? When we think about living with MBC, you know, our hope is that we can do the work so that people can live with this disease for a long time. But when it comes to heart disease, hypertension, diabetes, are those needs similar to breast cancer patients at this time?
You know, I'm sure there are some differences that are specific to particular health conditions because each one may place different demands on an individual or impose different limitations, challenges, or feel more acutely threatening perhaps than some. But I think there are many similarities too. I mean, all of them can contribute to anxiety, depression, and people living with chronic health conditions of any kind can benefit from mental health services. And I would encourage patients to ask providers of their specific health needs, about what resources might be available in those particular areas.
Great, thank you. Okay, so this is a submitted question during registration. Someone said, I am a breast cancer survivor and a single parent of a teen. I worry about getting COVID and not being able to take care of my child.
Wow. You know, as parents, I think whether it's breast cancer or COVID-19 or anything else that would feel a threat to our ability to take care of our children is a very hard thing to think about. And even as hard as that is, and as difficult as it might be to continue to sit with those feelings, now's the time to have some sort of plan, develop a plan. What would you do? What resources are available to you? Do you have family members that could help care for your child? How old is the child? You know, are they old enough to sort of be involved in developing of that plan? Where would they like to stay if they needed to sort of quarantine away from you? What are the options that are available? And as I say, as hard as it is to kind of tolerate the discomfort all of that could churn up right now, develop a plan before you would need a plan. I think that's what we all need, to have a plan before we need it.
Great, thank you. I like that idea of a plan. You know, trying to be prepared is always better, although I know it can be so easy to avoid something you hope doesn't come. Well, it doesn't look like, we'll leave it open for other folks to send in questions if you have them. There was a comment from a participant that spoke to classical stretch eccentrics program, she has found to be very all around calming, just stretching and strengthening, great for her range of motion. She's found comfort and support in that during this time. I think, and you've spoke to that too, that movement is something that can really help us get outside of our minds
Right.
and practice, coming back to where we are in the present.
And Krista, I will say, if people are looking for those kinds of resources, available through the UNC Lineberger website, there are online yoga classes, exercise classes, for people who are interested in integrative medicine and lifestyle consults. That's available online. Nutrition lectures that have been recorded are available there. There's resources for survivors. But if you're looking for yoga or some sort of movement exercise class, they're available through Lineberger.
Okay, great. Well, while again, we wait to see if anybody else has questions, that's what I was going to ask you about, just kind of what is available at Lineberger. And you shared some of those services, but what in particular about mental health services, excuse me, for anybody that may be in the area or may have more access to you now that we are in this tele world for help.
Yeah. So in addition to the things that I mentioned, I'll say that also on the Lineberger site, there's a section about wellness resources during COVID-19. And there's literally more than 1,000 resources that you can access through that. But specific to mental health, there are, I'll say, 3 layers of services that are available. The first are periodic phone calls, just sort of a check-in phone call that the staff in our Patient Family Resource Center are making. We're referring to them as comfort calls, to check in with people who may live alone or feel particularly isolated or may have questions, educational needs. Our nurse navigator and the Patient Family Resource Center are available to answer those calls. So I think right now they have a list of close to 300 patients that we're calling and checking in on from time to time. The next layer are counselors like myself, either social workers, psychologists. We are available for telehealth appointments through the UNC MyChart app. So we're offering supportive counseling, psychotherapy appointments online. And for patients who would benefit from medication management, who need a medication to help with anxiety and or depression, telemedicine video appointments are also available with our advanced practice providers. Our psych NP is available, as well as the psychiatrists who work with our group, all of whom have training and experience in working with cancer patients. So they appreciate what that experience brings to the bigger picture of anxiety, depression, coping strategies. And those resources are available to caregivers as well as to our patients.
Great, that's really great to know. Now, for someone who, is looking outside the center or looking for resources in their local community, do you have some suggested resources available or go-to websites to help identify those things for cancer patients outside of our area?
So I would encourage people to check in their local communities. That's going to vary from location to location. Your providers may very well be aware of what resources are out there, or the nurses who work with your providers. So that's always a good resource. Of course, if you touch base with some of the national organizations, have links to other resources. I've got a list. Let me see if I can put my hands on it here. My little cheat sheet here for resources specific to support around COVID-19. There's the National Alliance on Mental Health, NAMI. They have a great COVID-19 resource information guide, a PDF file that has a lot of information. The Substance Abuse and Mental Health Services Administration, SAMHSA, is another very good one. I mentioned Be Strong Families. There's the North Carolina Psychological Association, as well as the American Psychological Association, that has a lot of information and resources for mental health services. Psychology Today is another site that you can log on to and sort by state, by locate, by zip code, by symptoms, a number of filters to help find mental health providers in your local area. You can filter by insurance as well. So those are some of the bigger ones.
No, that's great. And I was trying to put some links in the chat box as you were talking. So again, I will be sure to follow up and make sure those resources are available to everyone outside of today's call. So I have put in a last call for if anybody have any questions. We are getting closer to the end of this hour. So let's see, give everybody here just a few seconds. And if we don't have any other ones coming in, I think, I know we've talked ahead of time and got some of these frequently asked questions together, that we were hearing, and some things that you had been hearing as well. I think, in closing, is there any, final comments or advice you'd give to those listening and joining us here today?
So as I said earlier, it's easy for us to kind of dismiss what we hear over and over, but for the high risk group, people who fall in that high risk, I don't see any changes in our situation for a while. I think this is, even as other people in our state kind of move through the phases, I think people in the high risk group are going to continue to deal with this for a while. So we need to shift our thinking, if we haven't already done so, from the mindset that this is a sprint to this is a marathon. And while we can reduce stress temporarily, stressful times are here for a while. And so we need to think about building resilience to help our systems tolerate that stress over a longer period of time. And as John Kabat-Zinn says, you can't stop the waves, but you can learn to surf. So that's what we need to be doing, I think, now, is learning to surf. And the way that we do that is go back to those basics of self-care, of adequate sleep, rest, nutrition, movement, light. Natural light is better, but light, being in nature, having some sort of routine. It doesn't have to be rigid, but if you can have a routine to keep your sleep-wake cycle pretty steady, and the times of day that you have your meals, that goes a long way for keeping our system in a routine. Schedule relaxation and fun activities. And then focus on those relationships that are important to us. We may have to be physically distant more than we would like to be right now, but that doesn't mean that we can't stay connected to the people that are important to us in our lives. We may have to find different ways of doing that, but that's so important.
I love the sense of your suggestion to schedule some fun, that it's just as important as scheduling self-care and everything else that we do, especially since, you know, as people, regardless of how extroverted or introverted you are, I think we at this time, we're missing people, especially those who live by themselves. I'm lucky enough to have family that I live with in my house and kids to keep me plenty to do, but for those living by themselves, I know it's been an especially tough couple of months.
Yeah.
Well, we're getting a couple thank yous. I think that wraps us up on questions for the audience. So, you know, I really appreciate your time and wisdom and knowledge and everything that you've shared with us today, Pam. I do just want to remind people that at Komen, we do have a 24-hour breast helpline that's available both in English and in Spanish for support, accessing resources, that's available for patients as well as family, caretakers, and loved ones. So know that's available at 1-877-GO-KOMEN. We also have a treatment assistance program. So if anybody, you know, has, I mean, the financial toxicity of cancer is high enough as it is without the additional stressors that some folks may be experiencing now as a result of COVID. So please reach out. You can access that support and see what our assistance can help with. That same 1-877-GO-KOMEN number. Something else that we have been offering for those living with MBC, it's kind of kicked off right before the start of the year, was a monthly support group for those living with MBC. So since COVID, we've taken it virtual, which is exciting for us in that, as you were speaking about earlier, Pam, you know, hopefully people who can't access us physically, you know, based on geographic location, you know, we're inviting them to join in the private, confidential Zoom space that we're creating for this group. So that MBC support group, Thriving Together, is the third Thursday of the month from 5:30 to 7. I'll share more information as well. We have information on our website. So, you know, follow us on social for more things like this. We're trying to share as many resources as we can to patients at this time. We want to hear what you need and do our best to support everyone. And again, we'll have lots of resources at our website at komennctc.org. So thanks to everyone who's joined us today. Thanks again, Pam. Any last words?
Stay safe, stay healthy.
Great. Thanks so much, everyone. We appreciate you all for joining us, and take care.